empty the bladder as we drink the water, and then we will insert it smoothly. You can go as you can see there. We fix the laser fiber. This is the theoretical side for mechanics. As you can see here, we fix the tip, the middle of the table by close, and the laser fiber all along the table. The starting setting in pediatric, we used to start with a 0.6 and 12 watt. You can see here the screen for it, 0.6 or 0.5, 0.5, and 12 watt. Sorry. So the total is for pediatric group, we use a 7.5. This is a 7.5 from Innovex. The question is quite amazing about deflection 275, 180, down deflection up to 285, and you can use the lock if you want to lock the scope. This is the scope continue pressing on your finger, the thumb here. The scope will be automatically locked. This is one of the advantages if you want to attack the lower pole stone. You can remove it, and by a passive deflection, it goes straight by itself.
As you can see here, Majed, that we are inside the kidney, 2.5 centimeter in a small girl. That was maybe 5 years ago or 10 years ago. People, they never imagined that we could do these cases with such gadgets. Very small bent gadget. And look, we spend about 35, 36 minutes. We finish all the stone because of this new modification in the laser dusting, in the access sheet with suction, in the smaller scopes. And it was like in 5 years, 6 years. And maybe in the future we'll be surprised. And I'm happy for the next generation. They might live better than what I do now in practicing.
Dr. Saeed,
yes.
I have comments and questions from audience and also from me. The first comment about the table arrangement. I think we should focus all the time about efficiency of endourology, efficiency. So table arrangement, one of the tool of how can we make our operation efficient. I like the way that you arrange the table and it's not crowded. So we should focus on these things as tips and trips in endourology. The second question about irrigation. Usually you use the manual irrigation or automated irrigation or on gravity?
I never use automated pump. I used to be big fan of this automated pump. I discovered it is by a big lie. What you need a gravity 40 to 60. You know the pressure inside the kidney 15, 20. Yeah. If you want to work in the safe pressure inside the kidney, you need a 30 to 40. If you use automated pressure from any companies, you put a 200, 100, you will kill your kidney. I'm sure that every one of us has a subcapsular hematoma because it's a 0.2 to 0.4% of your practice in the publication.
Even with suction, even with suction sheath, if we just
we don't imagine, we don't know. Before it was like that, but now with the suction, this will bring again the automated pump. But I think we need something like a law or setting to tell us you need this kind of flow pressure, you need kind of this stabilized pressure, you need kind of suction. We don't know. But now with the suction, yes, you can, but it could be dangerous again because the access sheet is 10 to 12. If you use an Endoscope or 9 French, you will have a small space to do suction. You understand me? Yeah. So it's a thing inside the surgeon. You cannot work with the automated pump 200 and use an access sheet, for example, 9, and you put a scope 8.7. You cannot, because this will create a problem for you. You have to be smart and know how do we do the physics inside the kidney. A kidney is like a room. You need to ventilate it. Leave the door open. You have to keep the window open. The air should circulate in free, not in a small and closed space.
What do you think, Dr. Saeed, regarding interior temperature? About the difference about small scope and big scope, interior temperature. It depends on that or only a laser setting? If
I think the smaller scope and the larger scope has nothing to do with temperature, and except this one thing, which is the irrigation. because whatever you put a small setting, for example, 12 or 15 watt, and you do not irrigate, you will have a temperature. And if you put a big scope, you will have less irrigation or less return fluids. So it is a very complicated situation. You have to work on that to understand the only thing matters here, that how much return fluid comes to you is not how much flow you that apply.
Yeah, right. So we have two questions, just if you allow me, about from audience. One audience, he asked about what the smallest size of flexible ureteroscopy and which company.
I know, I was in China 2 weeks ago. I know one company is doing 5.5 French, so I cannot declare things. Now we are getting crazy, but the smallest scope available in the market is 6.3 from a company, and a 6.66 from another company. 6.3 from a different company, I cannot declare it, and 6.6 from another company. But most of the companies, they have 7.5 now.
I think we should not mention any, as you said, declare about companies. But
Yes.
another question about
I have a conflict of interest. I'm sorry.
yeah, about the other question about the how you know how you'll trace your ureteral access sheath in case of upper ureteric stone by floor, or you can use this calibration on the scope. We can depend only on the calibration, or
Okay,
we
the
can.
calibration of the scope helps you to calibrate. Calibrate the ureter means is that ureter will obey you. We call it compliant. Means يا ماجد انه يطيعك. It means compliant means he will obey you. That's the inner part of the axis sheet. And then the inner part of the axis sheet will tell you how much you need the length. And of course, use a fluoroscopy. If you insert the uteral axis sheet completely, you have to do it under fluoroscopy, you see. But if it's slide without no problem, you don't need the fluoroscopy.
Okay, go on, Dr. Saeed, just because to save
So
time.
the take-home messages from this beautiful lecture, I enjoyed it with you, Majid, wallah. And take-home message section, ureteral access sheet, of course, decrease the intrarenal pressure, of course. And it gives us more stone-free, which is something very nice for certain patients, like the pediatric patient and the cystine patients. I have a case of cystine, they need to be 0 fragments. Before we used to basket, we are in trouble. Now this solved a lot of problem. And of course, you need a dusting laser. If you work with a 30 hertz Holmium, you can do it, but it will take time because these big fragments you have to go in, out to the small fragments goes between the axis sheet and the scope, or between the ureter and the scope. And of course, what I say that every French counts, of course, the smaller scope are much better than the bigger scope. And one thing we have to not to forget to emphasize of my colleague in Middle East, you cannot reuse these ureteral access sheets because the hydrophilic coating is a must. You cannot manipulate inside the ureter while you are using 4, 6 times, 7 times, and reusing of the disposable thing. We cannot understand why we jeopardize patient life and the ureters because we want to economize or make it less cheaper. So hydrophilic coating, if you want to reuse it, please touch it, feel it. And if you are right, just change it and do a new one and use a good instrument, especially for children. You cannot reuse instrument in
Very interesting topics about the miniaturization of endourology. It's very important and it's coming. All things in urology going to be miniaturization, small and small. Small ureteroscope is the future. Is the future for to treat patients safely. And as Dr. Saeed said, we don't want to put stent, then discharge the patient and bring patient to this procedure, then discharge the patient with stent and bring patient back. Small ureteroscope is very crucial and it's very important. Thank you, Dr. Saeed. You give us a broad uh, subject. You give us like 50 minutes. Very interesting. Thank you. I think we answered the question from the audience. Just one question. What's your laser setting? What's your laser setting for dusting and fragmentation and popcorning? This is I think Dr. Isam, he asked you. So this is will
okay.
be last
For,
question.
for the fragmentation, you cannot barely do you have to distinguish between TFL and the holmium. The holmium you can do fragmentation easily with 1.2 joule and do 10 to 15 hertz. If you want to do dusting, you have only the TFL because you have a low peak power. The lowest peak power in the holmium is 2000. The TFL give you 500. It means it's very slow and very dusting. It does not hurt the stone. So if you're using a TFL, use the 05 20, 06 20, 06 25, 08 20, 08 25. This is the maximum. You have to go inside the kidney with 25 watt with the TFL. For the holmium, will be 03 to 06 with a 20 to 30 hertz. This is for dusting, or maybe 40, but cannot surpass a 35 or 30 watt inside the kidney. For the fragmentation, the TFL does not do the fragmentation except with the new model coming, the I think the UMAX from IPG from Russia. They are coming with a new model.
Thank you, Dr. Saeed. Always, I have, in my personal experience, I have interesting to listen to your lectures internationally, globally, and today with having you in this webinar, very interesting, very precise, intelligent way to introduce the ideas. Thank you again, Dr. Saeed. And thank you for the Innovex to arrange this great webinar. And that's it.